Priority setting. Often, we are directed to start a program in response to a particular health problem. We might be facing a crisis situation, or perhaps funding to address a particular cause becomes available. But sometimes it is our task to choose a problem to work on.
The people we have brought together to plan a new program have different ideas about what health problem is most critical. We wish we could address all of them, but we don't have the resources. And so we have to determine priorities. And not just my priority or your priority, but a consensus priority. Of all the potential health problems we could consider, we have narrowed the field to 3: malaria, HIV/AIDS, and lung cancer. Certainly, a good case could be made for targeting any of these 3. We are able to select one by using a system that relies on data.
This is the BPRS, the Basic Priority Rating System. It allows everyone to see clearly the reasons why their personal priority may not be the consensus priority at this time.
We'll look at each of our 3 problems in terms of the BPRS equation, using all the data we have gathered. A equals the size of the problem, B is the seriousness, and C is the effectiveness of the intervention. We give each factor a numerical rating from 1 to 10. Malaria is our first problem. We give it a 9 for size. Malaria is one of the leading causes of morbidity and mortality in our country. For seriousness, malaria is rated 8. It can spread quickly. It kills, especially infants and children, and can exact a heavy toll in productive time lost. The effectiveness of the intervention receives a 6. There's no vaccine, and malaria is increasingly resistant to the more popular and inexpensive drugs. The score we arrive at for malaria is 150. HIV/AIDS is our second consideration. Its incidence is growing alarmingly, especially in the southern portion of the country. But still, HIV/AIDS presently affects a much smaller proportion of our people than malaria, so it receives a 4 for size. We rate it 10 for seriousness on many counts. HIV/AIDS is a killer. There is no cure. The urgency factor is great. We've seen in other regions of the world how quickly it can spread. In addition, the cost of health care is enormous, and the loss of productivity and the impact on others is devastating. Its score for effectiveness of intervention is hotly debated. After all, there are many kinds of intervention possible, which have shown varying degrees of success. Blood screening, education, condom distribution, needle exchanges, treatment of sexually transmitted diseases. We finally agree on a 7 for effectiveness of intervention. That brings the total score for HIV/AIDS to 168. Lung cancer is our third consideration. Although its incidence is growing rapidly, lung cancer presently affects a fairly small proportion of our people, and so it receives a 5 for size. We give it an 8 for seriousness. It kills most of the people it strikes, and the cost of health care and loss of productivity is devastating. Urgency is also a factor here, given that over 70% of the adult males in our country smoke. A lung cancer epidemic in the future is likely. The score for effectiveness of intervention is once again difficult to agree on. Lung cancer is highly preventable, but it requires a behavior change, stopping people from smoking. That's a more complex task, and some of the means for changing behavior, such as legislation and regulation, are not under the power of our agency. With a 6 for effectiveness, the total score for lung cancer ends up at 126. The numbers tell the story. Our highest priority problem is HIV/AIDS. Everyone has contributed to that finding, even if they had originally come in with a different idea. It doesn't mean we'll forget about malaria and lung cancer. When more resources become available, we can address them too.
Another group of individuals might have come up with a different determination. What's important is that this group will be committed to this priority.